guys, my name is Coulibaly. I'm a student at the University of Dallas in Dallas, Texas. I'm doing a presentation in my Big Data Analytics class. My topic is Healthcare Provider Credential. I'm pretty sure you're asking yourself, why did I choose this topic? I chose this topic because of a scandal that happened years ago. A man was accused of fraud. He was basically accused of practicing without credential, without license. And this actually causes a lot of damages to his patient. So I decided to focus my project on this topic. Now, let's talk about the purpose and the description of my dataset. The purpose of my analysis is to understand the proportion of the number of medical providers to the population of Washington counties. In fact, I'm conducting this analysis to gain insight on the distribution of the number of practitioners that is available in the counties with high density in the state of Washington. A brief description of my dataset will be that my dataset provides information on healthcare providers' credentials. It comes directly from the Washington State Department of Health database on the healthcaredata.gov website. It was collected as a service to the public to help users have more information about their physician professional licenses. Adding to this dataset, I retrieved some information from the Census Bureau website to help me deepen my analysis. So adding those two together, my final dataset included more than 1 million rows and 12 columns. To conduct my analysis, I asked myself several questions. The first question is, what county has the highest number of active credentials? In order to answer this question, I used two variables. So the first variable that I use is the sum of number of records. I use that one as a measure, and I use the name of county as a dimension. This helped me find out the county with the highest number of active credentials. I processed as followed. I started by filtering the status column to include only the active credential. Then, I marked the highest number to be in a distinct color to highlight the difference between that one and the other bar. As you can see on the graph, the county with the highest number of active credentials is Mason. It has about 13,986 active credentials. We can interpret this by saying that in the county of Mason, about 13,000 medical providers are allowed to practice on patients because they still have their credential active. My second driving question is, what is the most common credential type in the county with the highest number of active credentials? We already find out the county with the highest number of active credentials. So we can restate this question by saying, what is the most common credential type in the county of Mason, since that's the county with the highest number of active credentials? To answer this question, I used two variables. I used sum of number of records as a measure and credential type as a dimension. This helped me find out the most common credential type in the county with the highest number of active credentials. I started by using the result of the first question, which is Mason, to filter the data. Then I used the color function to enhance the visualization, and allow easy comprehension and interpretation. So this analysis shows that registered nurse license was the most common credential type in the county of Mason. As you can see, based on the legend, that the highest values are red, then come on the orange, which is the middle value, and the black is the lowest value. So we can clearly see on this graph that registered nurse is the most common credential type. We can try to interpret this result by saying that in Mason County, most of the practitioners are registered nurses. Then come my third question, which is what is the most common status among all credential status in the state of Washington? So in order to answer this question, I use two variables. My first variable that I use is status, and I use that as a dimension. Then I use sum of number of records as a measure. And this helped me identify the status the most common among all statuses. So I follow similar step as for the first two questions in order to answer this question. As you can clearly see on the graph below, my analysis showed that the most common status among all credential status is expired. Indeed, we have 711,000 credentials that has expired in the state of Washington. So per my data, most of the healthcare providers in Washington state have an expired license. We can also identify that the second most common credential is active, but there is definitely a huge gap between the expired licenses and the active licenses. And this brings me to my fourth question, which is the last question. I was wondering if all the practitioners that have active licenses are enough for the whole population in Washington County. So my last question is, does the county with the highest density has the most active status or the most expired status? So in order to answer this question, I use two variables. I use county name as a dimension and sum of population density as a measure. So I started by filtering the data once again to include only status such as active and expired for the purpose of classifying as either one of them. I also adjusted the color to represent the outcome as being either active or expired. As we can all clearly see on the graph below, King is the county with the highest density. It has more than 2 million population. We can also notice that King is being represented in the red color. As on the legend, the red mean expired while the blue mean active. So we can conclude that King, the county with the highest density, did not have the highest number of active practitioners, but instead has the highest number of practitioners with an expired license. It is essentially this essentially means that though King has the largest population, most of the practitioners living in that county are not able to operate on their patients. Now, Let's jump to the conclusion. To conclude, I can say that my data set that provides information on the healthcare provider credential has helped me come up with an analysis that helps take a more granular look at the distribution of medical providers across counties in Washington state, the license status, and the population density in those counties. The analysis made tell us that there is a problem with the distribution of medical providers in Washington counties. In sum, I can say that the purpose of my analysis, which was to gain insight on the distribution of the number of licensed medical practitioners that are available in the counties with high density, was verified.